very much. I hope you've all had a good lunch. So maybe let me start off by saying good morning, everybody. Oh yes, thank you for correcting me. I just needed to make sure that we're all together. So good afternoon. Thank you very much for being here. So we're going to start in perfect adolescent and youth constituency style, where we're going to use our slogan, which is Viva. And so when I say Viva Adolescent, respond by saying Viva as well. Are we good? Great. Viva adolescents, Viva!
Viva!
Viva adolescents, Viva!
Viva!
Viva Canada, Viva!
Viva!
Viva Canada, Viva!
Viva!
Excellent. Thank you very much for that. So before I just move on to my panelists so that they can share with you more about the purpose of this short launch, let me just give you a bit of background. My name is Paladi, as they've already said, and I'm the chair of the Adolescent and Youth Constituency of the Partnership for Maternal, Newborn and Child Health. And today we are going to be launching the two important and exciting frameworks that all of us, I think we've been looking forward to the launch. The first one is the Accelerated Actions for Health of Adolescents framework, which was developed by the World Health Organization, working together with the Adolescent and Youth Constituency. And the second one is the Advocacy, or rather Advocating for Change for Adolescent Toolkit, shortly known as the Advocacy Toolkit, which was developed once more by the PMNCH Adolescent and Youth Constituency, working together with Women Deliver. And these two toolkits complement each other. The AHA is more of the technical one for in-country engagement, and then the Advocacy Toolkit is more for youth-led organization on how they can enhance the advocacy efforts in country when engaging with various stakeholders. So just also to provide a little bit of background, the AHA was developed through a consultative process, which different platforms were used. There were also regional processes there, and it included different UN agencies, researchers. It also involved us as young people coming from our respective regions. And also it was led by an expert advisory group, which had 5 young people from the constituency who were part of that expert advisory group. So we were not just consulted, but we were also part of the actual decision-making process. And just also to share a little bit of other documents that are being launched alongside the Global AHA framework. There's the main reference document, there's the executive summary, there's the brochure, as well as an adolescent-friendly comic book, which was also developed by members of the Adolescent and Youth Constituency. There's also an adolescent-friendly version of the AHA, which is suitable for young people between the ages of 10 to 14 years, because it's important, as earlier on a young person was saying, that many of these documents are too technical. So how do we break them down for young people to also be able to use them and engage with them? And the Advocacy Toolkit basically is meant to build young people's capacity on national policy processes and entry points to engage meaningfully in the design, implementation, and monitoring and evaluation of programs relating to adolescents and young people's health issues. So these are the documents we are going to be launching today. Viva Adolescents, Viva!
Viva!
Viva Adolescents, Viva!
Viva!
Viva AHA, Viva!
Viva!
Viva Advocacy Toolkit, Viva!
Viva!
Great, fantastic. So now I have these absolutely great panelists who are going to be giving us a little bit of background on these documents. First, I'd like to call on stage first proponent of young people and our most vivacious leader, Assistant Director General of WHO, Flavia, and she's going to basically tell us about the AHA, who was it developed for, why is it important as a guideline, and who developed it, and what does really the Global AHA mean? Just give us a little bit of context on that. That's the first question, and I'm going to ask you a follow-up question on that. And Flavia, I need you to do that in just 2 minutes. Thank you very much. Viva Flavia, viva!
Viva! So first I have a little anecdote. When we were discussing in the very bureaucratic World Health Organization, where should we launch the adolescent health framework, we had no doubt that the best place to launch it was here. And we had no doubt we had to launch it in, I didn't know that she would come with Aviva, but to me it's the perfect way to launch it. I would just like to ask, if you allow me, Gigi, the colleagues that have worked on it, if I can please stand up, that we clap, and then we say what it is and why it was developed. Yes. Can we do that? Where is David? Where are the colleagues from the other UN agencies? The colleagues that have given inputs? Are you shy? What is this? Nobody wants to be... Okay. So just to give some attribution and some responsibility also to the colleagues that have worked. Now, many of you, I'm sure are familiar. When we launched in 2015 the Global Strategy for Women, Children and Adolescents, that had a very strong focus on adolescent health, a lot of countries and a lot of partners were very pleased and happy, but they kept coming back and asking, okay, how do we do it? What are the priorities? And a lot of questions were really on the how. So this group, part of the colleagues who were here with us, was set together to really try to extract the most updated knowledge we have on how do we do adolescent health programming, what are the things we know that work, particularly from countries that have spearheaded the process, like in India and other countries that have been at the forefront of that. So this is a document that looks like this, that we are launching, that is primarily summarizing this knowledge, primarily for colleagues that are working in the countries that want to address and advance the progress in adolescent health. But, as I said, even in a very bureaucratic organization like WHO, we also do things slightly different. And we also have these kind of, you alluded to, wow. This is kind of the comic version, I don't know if it's right to say comic, but a version that is simplified, that is trying to address the same substance, particularly to young adolescents. I think I've used my 2 minutes. Maybe the next question you ask me more on the content.
Definitely. Thank you very much. And just maybe in your closing, I mean, I know the AHA is quite packed because it is a technical guideline for in-country engagement, but maybe you could just flesh out or just the key messages that are coming from the AHA framework.
So number one of the key messages, which is also the message that we are launching during these days with the press actions that many of you are contributing, is we now have more data and more knowledge about adolescent health and adolescent deaths. And we currently have 1.2 million adolescents that lose their life every year, and mostly for causes that can be prevented. 2 decades ago, when we were looking at the overall progress on child health, these numbers seemed very small. But now, as we manage to make significant progress, particularly on under 5 mortality, it's very important to focus and zoom in into these causes of death and see how can we address them. But the AHA framework is not just about deaths, although there is a significant effort on looking at those deaths, but it's also about morbidity and particularly setting adolescents in their best health status for becoming healthy adults, healthy elderly, and also for becoming healthy individuals and parents that can transmit their health capital to their future generation. So the things that you will find there are suggestions and action for how do we address these multi-sectoral activities and agenda, because as we said already earlier during the day, for example, injury and particularly road traffic injuries is a key cause of death. How do we address that? These are clearly not just health sector actions. Mental health, we had a very interesting panel earlier this morning. These are critical issues, both leading to self-harm, but also maintaining and undermining the health capital that adolescents have as they become adults. So those are very, very briefly some of the key content. I know David that is sitting down there. He will not be very happy that I have shrunk all this rich and precious work in 3 minutes. But please, just to this distinguished audience, please take a minute, have a look at the adolescent framework and the documents. What will be very, very useful is that if you tweet about it, if you talk about it, if you raise questions about, and most importantly, if you raise it to the attention of deep policy makers for health in your own country. That's key message.
Thank you very much. Viva Flavia, viva! Absolutely great. Hashtag AHA is the way to go. So I believe all of us will be getting ourselves a copy. And just to move quickly to you, Tikala, and to talk about the advocacy toolkit, particularly on how it's going to better advance your work as youth-led organizations, particularly in advocacy as well as accountability in country, in just about 2.5 minutes. Thank you.
Wow, in just 2 minutes. So as a young person, and obviously like doing a whole lot of work in advocacy, this is simply awesome. Advocating for change for adolescents, and these have been like the key issues. I'm coming from Malawi, but I work a lot with different youth networks in Eastern and Southern Africa, but mainly in country context. I work with about 200 youth-led organizations on the ground. And most of the key issues we're finding out was, young people don't know, I want to be involved in policy making, but how do I do it? I want to hold leaders accountable, but how do I do it? What does accountability mean? What does that commitment mean? What do I do with this commitment? So there was so much information gap, and they didn't even know what the entry points were. And with the adolescent youth constituency, the partnership, PMNCH, World Health Organizations, we all came together and started engaging and trying to come up with a tool that actually gives young people, youth-led organizations and youth networks the power to drive their agenda. Because at the end of the day, we want to take lead and we want to drive these issues. We want to hold our leaders accountable, but we needed the know-how to do it. So this is exactly what this toolkit does. I don't know if there's a follow-up or should I continue?
No, you just end on your last point.
So I think, lastly, I think it's an analogy where I want everyone to see it as a car, right? With a car, you need a key, 4 wheels, and fuel to drive, right? You need a key like this toolkit. And this is a toolkit where young people have got that ownership. So you're giving the key to young people and youth organization as like, here's your ownership to drive that car. So you get into your car, there needs 4 wheels, and that's the support. That's the mechanisms that need to be put in place. That's the resources, that's the skills and the capacity building. Those are the 4 wheels that they need. And lastly, the fuel, which is all the partners that will push and drive that car together with the young people and the youth-led organization. And this is what it's all about. And in Malawi, that's what we're working towards too. And this is the start of a new beginning of driving the agenda. So.
Thank you very much. Viva Tikala, viva!
Viva!
Viva Tikala, viva!
Viva!
That was really awesome. Hashtag toolkit gives power. Hashtag advocacy toolkit is awesome. And last one, hashtag we are ready to drive. Isn't that awesome? Viva. Great. So now I'm going to move on to our last panelist, and it's Mr. C.K. Mishra, who is the Secretary of Health and Family Welfare from the Government of India, also part of the board, as the board co-chair for the Partnership for Maternal, Newborn and Child Health. And just as a member state, I just wanted to ask you, why should countries prioritize adolescent health and well-being?
Okay, that's an interesting question, and the answer is what you've been doing for so long. That is one of the main reasons why countries should really be investing in adolescents. See, there's so much of energy in this room, and the energy is because there's youth in this room. And it's not just because there's youth in this room, but because it's an empowered youth in this room. So that is one of the critical reasons why every country must invest in adolescent and youth. If you really want to reap the demographic dividend, and you really want to show that this part of the population can really deliver, the investments in government must really lie here. And it's not just about investing in adolescent health. That's one aspect. It has to be a comprehensive investment. Let me quickly give you an example of India. The size is 253 million adolescents in India. For the last few years, the government has just been focusing on investing on this segment. 70 million this year is what is budgeted for. We've come up 26% over what we did last year. The reason is that if you're not able to really invest and take this huge population in the right direction, you will lose rather than gain from this population. Therefore, it's a priority for every country to really invest in adolescents. Not just their health, their well-being, education, all of it comes together. And it is multi-sectoral. Unless you're able to invest properly, you will not have the dividend that you want.
Exactly. Very powerful. And maybe just to end your remarks, maybe you could also tell us that how would these two documents help you to deliver on the vision that you just talked about?
Yeah, these two documents, first and foremost, thank you everyone who worked on these documents. These were the need of the hour and just come at the right time, I think. As far as the AHA is concerned, I see it more as a guidance note for countries to follow. If you ask me, it's a global wish list, which will remain a wish list unless the countries want to implement it. So it has to be country-led. Having said that, very often in the countries, there's a lack of capacity to really structure a program, structure a chain of events which would lead to the results. This is the guidance which countries would need in terms of drop-down menus where they can pick up what they think is most appropriate, because geographies will have different needs. This is a comprehensive thing that guides the countries on how to implement. And if globally, all of you sitting here want anything to happen about adolescents, you will continuously have to work with the countries with such guidance and documents so that the countries are able to plan properly. Each country must have a costed plan when it comes to really moving the adolescent agenda ahead.
Yes.
The toolkit is another example of great thing that we're doing. It's a kind of a signpost. And this will really push countries to actually know what to do, when to do, and how to do. And again, I spoke about the multi-sectoral approach. It's the advocacy, which is very critical in this toolkit. The capacity building of the adolescent through advocacy is what is the central piece, according to me, of the toolkit. And I'm given to understand that we are beginning with Malawi, Nigeria, and India. So that's a great thing. But having said all this, nothing will work unless the adolescent are a critical part of whatever we are doing.
Exactly.
And one example of that is these two documents, where they have made it, they have done it, we are now supposed to carry it forward.
Viva Mishra, viva!
Viva!
Viva Mishra, viva! Yes, well, so we have come to the end of the launch, and maybe just to say that we'd like to thank the organizers, WHO, PMNCH, as well as Women Deliver for making this possible, but of course the lovely panelists for their contributions. The AHA as well as the Advocacy Toolkit are available outside, but also online for us to use in our work, and thank you very much for attention. Viva everybody, viva! Viva! Viva everybody, viva!
Viva!